welcome back to my channel. So today, of course, as you can see, it is a very rainy day. I just left orientation for the hospital that I will be precepting at, which is crazy. I actually was a patient transporter while I was in LPN school there. So basically we just had to do our AccuChecks, and we also had to get acclimated with the system to document, which we're using Paragon there, and I don't like it at all. So this was like a repeat for me because Tuesday I had work orientation, which we had to do a skill checkoff, which dealt with inserting the IV, central line dressing changes, hanging secondary and primary bags, and also my checkoff consisted on the AccuCheck and then like how things should be, how a patient room should be, like where the Foley should be hanged at, how their IV line should be, you know, checking to make sure it's not infiltrated and things like that. So I mean, this week was wonderful. I did amazing on my PEDS test. I thought I actually did bad, but I did really good. I'm so proud of myself, and I really think because I went to LPN school first, it has built a really great foundation on me gaining more knowledge and applying it into RN school. So I have a quick little interacting thing I want to do with you guys. I'm going to ask y'all a question, and then I'm going to pause for a little second to see if y'all know the answer. So the question is, when doing a blood transfusion and you see that the patient is going anaphylactic, what is the first thing that you do? And what other steps do you take after? All right, guys. So you're gonna stop the infusion. That is the most important thing to do, is stop that infusion. And then you're gonna assess your patient. Once you stop that infusion, you need to grab a bag of normal saline as well as new tubing for that normal saline to run that transfusion, because if you don't, it is possible that some of the blood particles has entered the previous tubing that was connected to the previous normal saline, and that can cause the patient to still have that anaphylactic reaction. So you want to, after you do that, you want to assess your patient to make sure they are breathing, and you want to notify the provider. So the reason why I asked you guys this, because blood transfusions are very important in a lot of disease processes for patients, such as patients that may have hemophilia or patients that have sickle cell crisis. So you have to intervene and know how to monitor when they're getting blood transfusions. So when you're first doing a blood transfusion for that patient, you're going to stay with them the first 15 minutes, and then you're going to get their vitals every 5 minutes, just to ensure that the patient isn't having a reaction to the transfusion. It does happen. I have seen a reaction to a blood transfusion before, and it's not nice. You know, they will give them Benadryl to calm down the hives, you know, and intervene and, you know, make sure the patient airway is patent. So I hope you guys have been enjoying my videos, and I'm just trying to come with a lot of energy. Like, I have a very country voice, and I hope that when I'm talking to y'all, I don't feel like I'm just talking at y'all. I'm talking with y'all, like when I'm educating you guys about things. I want to make my videos more fun. If y'all have any ideas that can contribute and make it more interesting for you guys, please comment down below, and I will definitely respond, and I will implement that into my videos. See y'all soon. So today entitles my clinical checkoff day. So today was really the practice checkoff for in-house clinical today. So she did demonstrate on how to do a central line dressing change, which I never got to experience in LPN school because it's in the RN scope of practice. So I was shown how to do that, and then I had to demonstrate it and get checked off for it. So in the meantime, while my classmates were doing that, I did my practice IV insertion site, my NG tubes, as well as inserting my Foley catheters, as well as my hanging secondary piggybacks. So pretty cool, right? So y'all, I'm just so happy. I was nervous about today because I was like, man, I haven't done those skills since LPN school, like most of them, because I didn't do that in the urgent care setting. I didn't do that in the detox setting. Like, where am I going to be? Am I going to be behind? But y'all, it just came back to me like second nature, and I'm so grateful for that. I do have a clip of me inserting my IV that will be displaying in this video in just a moment. So I have finally concluded my first day of in-house clinicals, and tomorrow is checkoffs. So I got to do a few more IV starts as well as IV piggybacks and the NG tube that I told y'all guys previously. So I did record me doing the IV start, but the video did not come out, well, the clip did not come out as I was pleased for it to. So I'm not sure if I'm going to add it to this video because it was kind of rushed, because it was like I was the very last person to do my last one. So the good thing is I do have an IV start kit at home. I just have to order my sponge from Amazon that bleeds red dye, so I can actually film a better way how to do an IV start for you guys and make a YouTube short for it as well, for those of you who maybe like myself haven't done too many IVs and aren't very comfortable with it. But I will definitely show that to you guys, and I might show the little quick clip that I don't really care for today. So right now I'm just gonna head home. I'm gonna hit the books and take a shower, eat something, and prepare for my checkoffs on tomorrow.